Dr. Shakib from Irvine Spine and Wellness Center, your Irvine Chiropractic clinic. What is the difference between adjustment and mobilization? That's what this video is all about. Stay tuned. All right, let's talk about adjustment. Adjustment, by definition, my version, is delivering force, a thrust in the direction that will move the fixation. So what does that mean? I palpate you just like this. This is a mock palpation. I actually felt something. So then there's a restriction in movement, and then there are different methods of adjustments. You can there's like over 120 different ways to adjust. The whole purpose of adjustment is to remove the fixation, increase mobility in the area. So it doesn't matter what method it's used. I always say you can take two ways to come to my office. I don't care how you get here as long as you get here. So it's the same principle. It doesn't matter how you get adjusted as long as the agenda is achieved. So mobilization, however, has to do with no delivering of thrust, where let's say this vertebra is not moving in the direction of extension and rotation. I go in and I actually isolate the area, that segment, and I take away all the different helpers that go in to help when it can't perform its job. You see, if I need to move my head this way and the vertebra does not rotate the way it should, the brain is gonna say, well, how about if we do a little bit more extension and then rotation and I can go farther? This is not something you're even aware of. That's what your body does. That's what your brain does. That's its job. It has many functions, but two goals. Number one, for you to live a long life. Number two, for you to have a pleasant day given what you throw at it each and every day. So if going like this is not going to be achieved and actually comes with pain, the brain's going to tell their neck, go up a little bit, and now you can go farther with less pain. And that's what you end up doing, creating the pathological patterns of movement, the wrong ways of going about making the movement. So with mobilization, I isolate the area, take away all the potential helpers to come in and help, and there's no pressure involved, though it can be painful, because then the area, the section of your, let's say in this case, the muscle and the ligaments that have to induce that movement have no helps and they're forced to do the work. That's how we take away, a combination with functional rehabilitation techniques like active release technique and things like that. Very, very focused, inducing movement in that section by having the patient make that movement, isolating that section from everything else. I don't know if I'm making any sense.
You are.
Good. Because, sometimes I do these videos and then I wonder if you're not aware of the terminology, which I try not to throw fancy schmancy ones at you, but if you really get it, because I've explained it good enough. So mobilization, there is no actual thrust delivery adjustment or using a device to deliver the adjustment or whatever the technique of adjustment might be, but it still induces mobility in that joint. I combine adjustments and mobilizations at the same time because mobilization actually allows the deeper soft tissue to do the work, whereas adjustment is right at the joint, so it's a more of a bone involvement within the joint. Anyway, I hope this helped. If you have any questions, make sure you ask them right below or use one of the methods of communication and send your questions to me. Remember, you're the designer and the director of your own life, so design and direct it the way you wish to live it. Please subscribe and share this video with your loved ones, and make sure you check out the podcast info, because now the blabbermouth is blabbering on a podcast. Life and Health Matters with Dr. Shakib. Thanks for watching.